Hi, Kylie. Hi, my name is Vicky. I'm going to be your nurse today. How are you? I understand you came for a physical and assessment today. Is this for college? Okay. So, can you first tell me your full name?
Kylie Walker,
Okay, your date of birth?
3/16/95,
Okay. And do you know what day it is?
April 15th.
And how about the president? Do you know who that is?
Barack Obama.
Okay, good. Okay, so I have a couple questions, and I'll ask you them while we're performing the health assessment. As you know, I just want to go over your vital signs, which we took in the other room. Okay, your blood pressure was 110/68. Your pulse rate was 91. Your oxygenation, which is called SpO2, on room air was 100%, which is great. And you also had respirations of 18. Okay, so you seem to be, at the first glance, you seem to be in pretty good health. I'm looking at you. You look like a healthy girl. You're appropriately dressed. I saw you walk in here. You had steady gait. Um, can I just ask you a couple of questions? You said you're a full-time student. Do you also work?
Yeah.
Okay, what kind of work do you do?
Waitress.
Okay, so you're on your feet a lot.
Yes.
Because I understand you came in because of the red bumps on your feet,
Yes.
on your ankles. Okay. And I just wanted to ask you, can you tell me a little bit about your diet? Like, what kind of foods do you eat mostly? You eat proteins, high fat, fast food?
Proteins.
You
Vegetables.
eat vegetables? Okay. You don't eat a lot of carbohydrates, or you do?
Okay.
Oh, you do? Okay. All right, so I understand that you were born premature based on your health history, and you had some surgeries? What kind of surgeries did you have? Bowel surgeries.
Short bowel syndrome. Bowel obstruction.
Okay, so you had your bowel syndrome. So you had some of your bowel removed.
Yes.
Okay. Did you have a colostomy bag?
Yes.
And a G tube as well?
Yes.
Okay. All right, so you must have been on that TPNs, the
Yeah.
central line? Okay, wow, your mother had a big challenge, huh? Okay. Is your mother still alive? How old is she?
50.
How? You're too young for her to be 50. How old is she?
45.
45. Okay. All right. So, is she in good health?
Yeah.
Okay. And what about your father?
He's 51.
Okay. Any health issues there?
Hypertension.
Hypertension. Okay.
And alcoholism.
Oh, and alcoholism. Are his parents alive still?
No.
And do you know how they passed?
One died of a stroke and one died of complications of polio.
Okay. And I think we can go over more of this as we talk. And what about your mother's parents? Are they alive?
Yes.
Okay. Any health-related issues there?
Grandfather had a stroke at 46
46, young.
due to, I think, high blood pressure.
High cholesterol,
High
maybe.
cholesterol.
Yeah.
And then
That's
grandmother.
usually like more like a high blood pressure combination or clot or something of that nature. Okay. And your grandmother?
She has COPD, emphysema,
Smoker.
obesity, diabetes, depression.
Do you know how old she is?
64.
Okay. All right. Wow, she's got a lot of stuff going on. She's a smoker?
Yeah, she had a heart attack, had 2 stents put in. That's it.
Do you smoke, Kylie?
No.
Do you drink?
No.
Any drugs?
No.
No. Okay. Sexually active?
Yeah.
Oh, okay. Safe, right?
Yes.
Okay. How about, are you aware if all your vaccines are up to date?
Yes.
Okay. And flu vaccine? Did you have a flu vaccine?
No.
Okay. Let's get started with some of this health assessment, and I'll ask you some questions along the way, okay? So did you ever have any head injuries?
No.
Okay. Never had a concussion? Play sports?
No.
No? Okay. Never banged your head, car accidents, anything like that?
No.
Okay. Any pain while I'm palpating?
No.
Okay. I'm feeling for lesions or any lumps in the scalp area, and I don't feel any. I'm also at the same time I'm feeling your skin. I feel that it's clean, dry, and intact. Okay. Now you can move full range of motion both sides. Beautiful. Okay. And what I'm gonna do is feel your sinuses. Okay. Any pain?
No.
Do you have any problems with sinuses? Any hay fever? No. No sinus problems. Ever get sinus infections? No pain as I'm palpating? No.
No.
Okay. All right. I'm gonna feel here. Can you open and shut your mouth? Okay. Any pain?
No.
Okay. That's a I can never say it. Trigeminal nerve. I'm going to just do a quick test of your ears, your hearing. Can you put your hand on that ear? Can you repeat after me?
ABC.
Okay, let's go to the other side.
1, 2, 3.
Okay, beautiful. There is another test that we do with a tuning fork, really, but I don't have one of those, so we're not going to do that one today. But that one is appropriate. We already checked your eyes with the Snellen test earlier, and you told me that you wear glasses, right? When was your last eye exam?
Last week.
Oh, okay. Any problems with that eye exam?
I have astigmatism in my left eye.
Okay, okay. All right. So, do you feel any pain when I press?
No.
Okay. Can you look up for me? Okay, I'm just going to lift your lids, look at your sclera. It's white. Beautiful. And the conjunctive, I have to get my speech checked. Conjunctives, and there's no discharge. It's pink, which is appropriate. Okay. I'm going to take the pen light, excuse me, and I'm going to just look into your eyes. Okay. Look straight ahead. Okay. Okay. So both your pupils are what we call bilaterally equal and reactive to light, which is exactly what we want to see. Can you follow this? Okay, beautiful. Okay, cover this eye for me. All right, tell me when you see my hand come in.
Yeah.
Okay. Other eye. Tell me when you see my hand come in. Okay, good. All right, that just checks your peripheral vision, okay? Let's check some of your cranial nerves. Can you lift your eyebrows for me? Okay. Okay, what about a big smile? Okay, blow out your cheeks. Okay. Could you, oh, I'm sorry. I just drew a blank there. Sorry about that. Okay, close your eyes. You feel this?
Yes.
This?
Yes.
This?
Yes. Yes. Yes.
Okay. Alrighty. I'm gonna clench your teeth. Okay. Resist. Okay. And blow in. Breathe in. Excuse me. Breathe in. Okay. Alrighty. Okay. So now I'm gonna look into your nose. Okay. Your nose is symmetrical, which is perfect. Okay. That's what we like to see. You have no piercings in your nose, as I can see. I'm looking up into your nostrils. I don't see any polyps, any discharge, any bleeding. Your septums are not deviated. Good. You have no problems breathing. Sleep well at night?
Yes.
How many hours a night do you sleep?
8.
Oh, that's good. Very good. Okay. I'm also going to look into your mouth now. Open nice and wide. Okay. Okay. You had your wisdom teeth taken out?
Oh.
Okay. Okay. The tonsils are 2+. Good. Can you swallow for me? Okay. Open. Okay. Okay. So the soft palate and uvula raise at the same time. Okay. And the uvula is midline. It's perfect. Okay. And tongue is pink and moist. Excuse me. And I don't see any missing teeth. You have nice, good oral hygiene there. Brush teeth every day?
Yes.
Okay. And you said you don't drink, you don't smoke, right? Okay, beautiful. You're a visitor, huh? Okay. I don't know. Okay, so what I also want to do is right now I'm going to check your lymph nodes. No swelling, swallow. Okay. Checking your throat. Any thyroid problems in the family that you know of?
No.
Any that you have?
No.
Okay. And check your carotid arteries. I'm feeling for a pulse, which I do one at a time. That's just so we don't have any problems here while we're giving you this exam, Kylie. Okay. Okay. I'm going to listen for roots and trills, which would indicate blockages. Can you put your chin to your chest? No pain?
Yeah.
Okay. Just feeling your spine go forward a little bit for me. Okay, got a nice curvature. No problems. Never had any back issues. No back problems.
No.
Can you lift your shoulders for me? Okay. I'm just going to check your skin. I keep continuing to check your skin. I feel for any excess moisture or vice versa, any diuresis. Okay, and your skin is cool, dry, and intact. It's not. I wouldn't say it's exceptionally cool. It's normal to the touch. I'm just going to pinch a little. It's called skin turgor I'm checking for, and that's indicative of being dehydrated or hydrated. You drink a lot? Yeah. You drink a lot of water during the day?
Yeah.
Okay. Any other vices that you have? You drink a lot of coffee, a lot of soda?
Coffee.
Coffee every day? Decaf?
No.
No. Okay. Because your heart rate, even though it was within normal limits, it still was 91. So I'm curious. I'm not surprised that you tell me you don't drink decaf coffee. Okay. So while I have you facing this way, I am going to listen to your anterior lung sounds, and there's 10 spots for that. Okay. I'm gonna breathe in. Okay, lung sounds sound great. They're clear. That's good. But I also I'm gonna listen to your heart sounds on this side too. We go from the second intercostal space to the fifth, okay? This is the aortic. So I can hear your heartbeat here. Pulmonic. Nice. Tricuspid. Mitral. Just going to listen to two more lung sounds over here. Over here. Okay, very good. Okay. Any bronchitis, any colds that you get like that? No?
No.
Okay. And you said your diet is pretty good. Okay. You had all your shots, you said. How often did you go see the doctor?
Every 6 months.
Okay. All right. Let's see. Any health problems? Any as you grew into an adult, do you have any health problems?
Like chronic anemia.
Oh, chronic anemia. Okay. Any time that you see that you have more or less of a problem with that? In other words, is there any associating factors that would go along with this?
Short bowel syndrome.
No, in other words, any certain time. For example, when you get your menstrual cycle, do you feel it worse?
Yes.
Okay. What do you do? How do you know when you're feeling anemic or that your iron is low? Do you have any signs? Are you able to tell when your body's getting low?
I'm tired. My hands, my joints hurt.
Any temperature
Cold.
tolerances? Cold a lot? Okay. All right. So let's go on. Let's move on a little bit. Let me feel your hands now. Okay. Your temperature's good. Good. I'm gonna check your capillary refills. Okay. And it's your blood return and the capillaries refill within 3 seconds, which is normal for us, okay? That's what we want to happen. So you must be feeling pretty good. When was the last time you had, do you take iron on a regular basis?
No.
Orally?
No, but I get iron infusions.
I thought in your health history when we had asked earlier that it was written down that you took ferrous sulfate, which is iron. Did you realize that was iron?
Oh,
Okay.
Yeah.
And I see that you take biotin also. Is that for your pretty hair and nails? Okay, that won't hurt you. It's over the counter. All right, so let me also, what I want to do is I want to listen to your posterior lung sounds, okay? So could you turn around for me? Okay, just going to listen. Okay, ready? Listen. In and out. 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 Beautiful. Okay, I'm going to listen for crepitus. I want you to say 99.
99. 99. 99.
Okay.
99.
Okay. And then I'm just going to... Okay. All right, I'm going to just give you a little bop here, and I want you to tell me if you feel any pain, okay? Any pain?
No.
Any kidney issues?
No.
Urinate fine, no frequency, no dysuria. What we call dysuria is difficulty urinating. Any burning sensation? Any bowel movements? How many a day would you say?
2 to 5.
2 to 5, and that's due to your short bowel syndrome, I'm sure, right?
Yes.
Okay, but not. Do you have any blood or any discharge when you go to the bathroom?
No.
Okay. Okay. Could you lay down for me, Kylie? Okay. What I'm gonna do is I'm gonna Just ask you to lift up your shirt a little bit. Do you do have you ever had a mammography?
No.
Okay. However, do you do self exams? Feel for lumps or anything?
Yes.
Okay, you know how to do that? Okay, so it's important that you do that every so often, okay? I say every month in the shower you look. You have no discharge or anything from the nipple area?
No.
Okay. Okay. I'm just going to listen. At first I look, I'm inspecting your skin first, just so you know. I'm looking. I see even. I don't see any abnormalities in your belly. You're asymmetrical. Your umbilicus is even and symmetrical. Okay? So I'm going to just listen for bowel sounds. I listen in the upper quadrants, and the lower quadrants. And I hear it. I hear a lot of bowel movements in there. Not bowel movements, excuse me, bowel sounds. Okay, very good. Okay, so the other thing that I feel for when I'm here is I feel for tenderness, okay? Do you feel any pain or tenderness?
No.
Okay, when I palpate, no?
No.
Okay, beautiful. Okay, so we listen and we feel, we make sure there's no hernias or bulging anywhere, okay? Up here, in your left lower quadrant, your right upper quadrant is your liver, okay? So I'm just going to feel for that, okay? Palpate. Okay? And over here is your spleen. Do you feel?
Yeah.
Okay. I mean, do you have any, what I mean is, do you feel any pain?
No.
No. Okay, beautiful. Okay, so now I'm gonna be tapping you, okay? It's called palpating. I'm gonna be listening for dullness and tympany, and that's what I should hear when I do this, okay? So over the main organs, I hear there's dullness, which is expected. In the lower quadrants, that's hollow there. The stomach and the ileus, okay? Beautiful. Now I'm going to feel for femoral arteries. Okay, I feel that. Okay, you can sit up, Kylie. Let me just feel your pulses, your radial pulses. Okay. And you said you have pains in your joints at times?
Yes.
Often?
Yeah.
Okay. All right. Also, I asked you earlier if you exercise. You said you don't hardly exercise. Do you get out of breath when you exercise? Okay. But walking at work and the waitress work is okay. It's not too much. But you said that's when you do see, after a couple of days of working, that's when you sometimes see these lumps on your legs?
Yeah.
Okay, so we'll try to get to the bottom of this. Okay, so let me feel, right now I'm feeling for you, pound pulse. Okay, and I feel that that's behind your knee. Okay. Now I'm feeling your legs. Temperature is good. There's no warm. You're not warm, which would sometimes worry us if you're too warm in the lower extremities. I don't see any swelling. There's no swelling or edema in the bottom lower extremities. Okay. I'm feeling for pulses. Okay. Orthopedias. Okay, so I feel feet. Okay, and I'm just gonna touch the bottom of your feet. Your feet. Okay, your toes curl up, which is expected. But I don't see any lesions, any cuts, any abrasions anywhere on your feet, your toes. Capillary refill on the toes is perfect. Okay. All right, so we'll go and we'll continue the health history. Can you just stand up for me? Okay. All right, and I just want to see you walk about 5 feet that way. Turn around, come back to me. Okay, so you see, your gait is very steady and not off balance. Okay, any dizziness? Stand up again for me, please. Close your eyes. Any dizziness? Okay, I'm going to try to push you a little bit. No? Okay, any dizziness? Okay, Kylie, you can have a seat. Do you have any questions for me?
No.
Okay, well, thank you so much. We'll go over the rest of your health history inside, okay? In case you have any questions, but I'll type everything up and get it to the school, okay? Thank you again.